Well, all right, we're here with Dr. Cohen, a orthodontist in Fort Wayne, Indiana. Hi, Dr. Cohen, how are you today?
Good. How are you today?
Very good. Dr. Cohen, you are an orthodontist, which is basically a doctor who puts braces on children and adults and straightens out their teeth if and when they're crooked. Tell me a little bit, tell the people listening to this video a little bit, a little overview. What is an orthodontist and how do you practice? Because with no doubt, different doctors in all fields have different philosophies. Give us a little bit your background, where you come from, and what brought you to do orthodontics. What do you like about it? What's important? Things like that.
Well, that's a whole bunch of questions all at one time.
I know.
I will say that your first statement of just putting braces on teeth is very oversimplified. As an orthodontist, at least the way that we practice here, we're really responsible for the entire lower third of the face. We can affect the chin position, we can affect lip support, we can affect airway, swallow patterns. There's a lot of things that we're responsible for other than just making straight teeth. When most people come to see me, they come because they have crooked teeth and they want their teeth straightened. That's very definitely a valid reason, and we're really good at doing that. But it's kind of a byproduct of what we do. Really, the more important part is that we can actually improve the function of the jaws, of the muscles, of the joints, of the airway, and improve looks at the same time.
Wow! So an orthodontist is also a cosmetic surgeon.
Yep. Well, that's kind of true. We're kind of a bloodless cosmetic surgeon. We don't have to deal with some of the operation type things, but yes, we can change a person's appearance, not just their teeth.
Well, that's quite interesting. I'm sure lots of people didn't know that because, well, I surely didn't, but it makes a lot of sense. Obviously the structure of the teeth and all kinds of things, do affect the way a person will look. Well, tell me, in your practice, is there anything in particular? Obviously, it looks like you're paying attention to the whole holistic things of what the mouth can do, should do, and that's super important. So patients get more than what they bargain for when they walk in. They want their teeth straight, and that in itself is good, it's valuable, it's all wonderful, but they get a little more. You basically match it to their face and make it coming out the best looking. Or does it also change things such as, let's just say, aligning the mouth so that there are no tensions in the head and in the muscle? Is that kind of like also part of when an orthodontist gets through all this whole thing?
Yes, we're responsible for the entire neuromuscular system of the lower part of the face. We try to make the jaws line up so that they're balanced. If the jaws are balanced, then most of the time the muscles will be balanced. If we can balance the muscles, then we can eliminate a lot of times significant headache problems. Not only that, but we can also, as I said, help with airway. There's a lot of research now in sleep apnea problems that jaw position and joint position have a lot to do for some people that have restricted airway problems, and we can help with that too.
Wonderful. In your practice, do you see lots of adults, no adults? I mean, is orthodontic, is it for adults as much as for young people? Is there a specific trend? Tell us a little bit about it.
Very definitely. With the technology that we have now, the combination of our cone beam CT scan that allows us to see the head in 3 dimensions, and also our Sure Smile system, which allows us to do virtual treatment and robotic technology. It allows us to treat most of our adults almost like we have treated our kids in the past. Yes, we don't have growth to work with in our adults, but there's really no reason why we can't move teeth much farther, much faster than we ever could before. I would say that probably our practice is about 35% adults, and it is growing. The adult market is really one of the most underserved markets in orthodontics, and we want to try to address that by doing some of the things we do with our technology.
Wonderful. Thanks a lot, Dr. Cohen.